Hello, good morning. Chest pain due to lung related problems. So, how do you know when you have chest pain? The chest pain is nothing to do with the heart, but the lungs. Well, let's break it down. When you have a cough, and it's getting worse, if the pain gets sharper when you take a deep breath, when you cough, or when you sneeze, it could be you have a lung problem. And chest tightness with infection of the lungs, pneumonia, or bronchitis may cause pain along with fever, cough, and some people will have temperature as well. And shortness of breath. When you're feeling that you can't catch your breath, when you speak, you're struggling to speak because of the chest pain, and the chest pain is obvious it was not anything to do with your heart, it's to do with your lungs. So when you are finding it difficult to catch your breath, or breathing is getting harder, it could be chest infection. When you're coughing up blood, even a small amount of blood with chest pain is a red flag. So you need to see a doctor. Sudden sharp pain, a blood clot in the lungs, normally they say PE, pulmonary embolism, can cause sudden stabbing chest pain. Okay? Seek help immediately if chest pain comes with severe breathlessness. You find it difficult breathing. If you find it difficult breathing and it's severe, seek medical help immediately. Dizziness or fainting. If you're feeling like dizziness or fainting with this chest pain, seek immediate help. Blue lips. If your lips have turned blue and your fingertips have changed color while you're having all this chest pain, seek immediate help. If sharp pain, let's say you went on a long travel, you travel abroad, a long flight, and you start having pain, it could be you have PE, pulmonary embolism. Pulmonary embolism. That's blood clot. Layman term, blood clot. So seek medical help. Okay? Please listen very carefully. Today we are talking about chest pain due to lung problems, lung issues, lung related. Last week we discussed about chest pain due to your heart. But today we are discussing chest pain due to your lungs. Chest pain due to your lungs. There are two different things from chest pain due to your heart. We've discussed that already. Today we are discussing chest pain due to lungs, lung issues, lung problems, lung related. So today we are discussing chest pain due to the lungs related. Okay? So I start one. How do you know the chest pain is to do with your lungs? Remember, last time we discussed about chest pain due to a lot of things, but today we are discussing chest pain due to your lungs related. Okay? So now, if you are getting sharper pain, you're getting pain and it's getting sharper when you're breathing in, when you're coughing, when you're sneezing, it might be the lungs. It's related to your lungs. If you're having pain, sharp pain, when you're breathing in, when you're coughing, when you're sneezing, and the pain is getting sharper, which means it could be your lungs. It's related to your lungs. Okay? It could be it's related to your lungs. Okay? Shortness of breath. That's another symptoms to show that it's your heart. Feeling like you can't catch your breath. You can't catch your breath. Or your breathing is getting harder than usual. This could also be something to do with your lungs. Remember, the first one is worse with the pain is worse when you're breathing or when you're coughing. Second one, shortness of breath. If your breathing is getting harder than normal for you, because we are different. So if you have COPD, that's totally different. But if you are having chest pain and you're breathing, you start having difficult or shortness of breath, you're breathing, you're finding it hard to breathe, it could be something to do with your lungs. If you're having chest tightness with infection and you're having chest pain and you're having this tightness, and it could be that you have pneumonia. Some people will say chest infection. Okay? Pneumonia, chest infection, or bronchitis. Right? So if you're having this, and if you're having pneumonia, that's how you know. If you're having pneumonia, or commonly known as chest infection or bronchitis, most people will be spiking temperature. Yeah, you feel warm to touch, okay? And that's fever. You have cough. It could be definitely to do with your lungs. You're coughing, you're having fever, and it could be you're having this, people say chest infection, but that's pneumonia or bronchitis. If you're coughing up blood, even a small amount of blood is a red flag. If you're coughing up blood, is to do with your lungs. I know there's other things that can make someone to bring out blood, but coughing up blood is different from vomiting blood. Okay? If you're vomiting blood, is different. It's to do with your gastric. Okay? But if you're coughing up blood, because your coughing is from your lungs, is to do with your lungs. Right? If you're having sudden sharp pain, especially when you've traveled, maybe you had a long journey, you traveled to maybe abroad, more than 7 hours travel, and you're having pain, or you had surgery and you have been immobile, you have not been mobilizing, you have been sitting one place for several hours, and you started having pain. That pain, it could be you have PE, pulmonary embolism. Normally, people will say blood clots. Blood clots. Yes, you say blood clot. Okay? If it's confirmed, this PE, when you travel and you have this pain, sharp pain, it could be this blood clot, pulmonary embolism, and it can cause sudden stabbing chest pain. Okay? Seek help immediately if chest pain comes with severe breathlessness. Severe breathlessness, seek immediate help. If you're feeling dizzy or feeling fainting, seek help. If your lips are blue or your fingertips are bluish, if your fingertips are bluish or your lips are blue, seek immediate help. And if you're having sharp pains after long journey or long travel, please seek help. Medical help, emergency medical help, because you need urgent care. Okay? So that's all for this chest pain due to problem in the lungs. Okay? So today we've discussed chest pain due to your lungs. So if you're having all these I've mentioned, please seek immediate help, because it could be you're having a very severe emergency situation, especially the PE, the blood clot. You need immediate help, because if that clot dislodges and goes somewhere else, it can block the arteries, the arteries and the veins of your heart, and then the person will have a bigger problem. Please listen attentively to this and take notice and take care of yourself, because this life is one life. Thank you for listening. Until next time, if there is any topic you want me to discuss in line with my nursing career, I can always discuss with you. So drop me a note or comment that you want me to discuss this in layman's terms, and I'm happy to do that. Thank you so much for watching, and thank you for the likes. I appreciate Christiana. I appreciate all the people that have been giving me likes. I appreciate it, because that encourages me to speak more and know that people are listening, because this can save anyone's life. It can save anyone's life. So thank you so much. Until next time, just drop a comment what you want me to discuss next time, okay? Any nursing related issues or health promotions, I'm willing. Okay, thank you so much. Bye.